But I also think that, we're not looking at some of the key causes in the opioid crisis. So, and I think that one of my favorite books, which is Elizabeth Rosenthal's An American Sickness, she really breaks down how did we get to these places. And if you think about the opioid crisis, it's overprescribing, but you can't blame the doctors for overprescribing, because the overprescribing is actually coming from HCAHPS, because there's an HCAHPS score of was your pain managed, and so there's this sort of expectation of pain management. And in particular, we do a lot of work with total joint replacement surgery, and when someone is prescribed opioids after total joint replacement surgery, they're always basically prescribed a large number because you can only prescribe them in person. And so if you just had your knee replaced and your pain's not managed, you can't get back in. You can't physically get somewhere to pick up a prescription. And so they give you too many, basically, in case there's a problem. And then what happens is, we actually, in doing a focus group with patients, not patients that were our patients, but just people who had joints replaced, we heard about a patient who, she took all of the opioids that were prescribed to her because they were prescribed and the doctor told her to do so. So one of the things that we do is in our software, pre and post surgery, we're checking pain medication usage. So, and if someone's not tapering off fast enough, we can alert the care team. So there's a bunch of things going on here. There's, how did we get to here? How are people being educated about these drugs, and how to take them, and how quickly to stop them, and how do you think about really closing this full loop? So it's great that Facebook is solving this or trying to come up with a solution, but it's almost like it's too late. So how do we think about moving these things up further?